Hello everybody, Ravi Coach from the Chinese Gurukul. Now you can see that my soldier is now injured. I have the rotator cuff repair operation. So because of that I can't put the videos for next maybe 3 or 4 months because it is going to be repaired all this thing. In future I am going to put upload the video about this how I am going to recover and rehab this problem so everybody can understand. So I am going to give you information about how the rotator cuff repair is happening and how I am going to recover all this thing, and it is going to be so everybody can understand that what is the cause of the rotator cuff repair and how we can cure from there and what type of operation and all this. So first thing we must know that what is the symptom of the rotator cuff. The first symptom is the pain, and this pain is very severe pain. Sometimes upper arm activity you will get the pain, or sometimes you are sleeping also, that time you are getting pain. So pain is the main cause of that, and then you have to go to the doctor. Like me, I went to the doctor and then physiotherapist, and they told me to go to the ultrasound. And after that ultrasound, they found that they are having some problem. They sent me to doctor, the expert who is doing this rotator cuff, Dr. Gupta. He is in Fortis hospital. Dr. Gupta is the expert about this shoulder and the knee transplant and like ligament thing. He did my rotator cuff shoulder operation. So first we must know that what is happening in the shoulder. So in this shoulder you can see that in the shoulder we have the full arm here. Okay, in this arm there is a bone, 30 bone in hand. One is this humerus, and then there is ulna, and radius is the 2 bone here, and then there is the wrist. We have the 8 bones, the carpal, and then from wrist to the finger they have attached bone, 5 attached bone, that is the metacarpal, and then 14 bone in the finger, that phalange. So that is the total, but the thing is happening in the upper part of the humerus. In the humerus here they are having the group of the muscles. 4 group of the muscles are here, and that muscles is the upper one is the supraspinatus, then infinitus, then teres minor, and the backside one is the subscapularis. So these 4 muscles is holding the humerus, and it is helping to hand to move or pull anything or going upper arm activity or rotate the arm. This thing is helping inside. So now is the thing is why it is happening. So the happening means what is the cause of this? The cause is the upper arm activity, lot of upper arm activity, or you are teaching or throwing, or sometimes you can pulling the thing very hard or pushing. So this type of activity is the cause of the rotator pain. It is very common nowadays because the upper muscles, supraspinatus, this muscles is teared sometimes, and it is a very common injury for the athletes nowadays. So there are a lot of operation is going on. Dr. Gupta told me about that because he is expert. He is doing this thing. It's very common nowadays, and this is the cause of that. But what happened to me? Then how we can cure? So there are 2 types of operation. One is the open operation, which will cut and do this, and another one is the orthoscopic operation. So my one is done by the orthoscopic operation. Orthoscopic operation is they are putting few holes are here, and they put the orthoscopic equipment inside with the camera and light, and then they will going to tear the tear muscles. They will stitch it, and they will pull down, and they will put the 2 holes with the anchor. I am having the 2 holes inside, and they put the anchor and then tie down with the muscles to pull the muscles, and they do this. So this is the operation. This is the orthoscopic operation. What did to me? What was done to me? Okay, and that is happening now. But after that, it is very painful. I can't sleep for the last 5-6 days, and I have to be sit down only. I can't lie down, and very painful. And but still, after 2 days, they told me to give some mobility exercise. So in this case, I can see after 4 days, I am now able to do this. This thing I can take off about 4-5 days, 4-5 times a day, and then I have to be doing some this exercise and putting some ball inside, the sponge ball I'm doing this, otherwise we have to do this one. Then wrist movement like this, but this one I can't move, so this one is here, and then pronation and supination I have to do in my forearm, okay, and then after that I will slowly I can use my left hand to support to up and down movement only. This much that one I need to do at least 3 to 4 weeks, and after that I have to go to the physiotherapist and they will do the rehab exercise for the next 4 months, slowly to strengthen my muscles here, and after that in future maybe I will get the power back and I can do the sports, and I hope I can do the video also, and I will play the tournament also. So, and in that time I'm going to inform you how I'm going to recovering and what type of exercise, the rehab exercise I'm going to do to recover my things. So I will try to upload that one, and hope you like this one, and it is very informative. So everybody must know that what type of problem is this and how we can recover. So so in next video I'm going to show you that how they will do today evening they are going to dressing, and after that they will cut the stitch, and then I have to you know that it is very lengthy process, and slowly so 15 days after they will cut the stitch, and then that thing. So I hope next week I'm going to show you how many holes are there and how they are doing the dressing, and then stitching, how they will cut the stitching. Okay, so thank you very much for watching.